What if you could see a doctor, get a prescription, and even talk to your vet when your pet needs help, all without leaving your couch? Hello, friends, and welcome back to the Healthcare Wayfinders podcast, where we are routing you to more accessible and cost-effective healthcare. In this episode, we sit down with Jesse Ohayon, founder and CEO of Doctegrity, a company redefining what it means to access healthcare. From 24/7 telemedicine in English and Spanish, to groundbreaking features like facial scanning for vital signs, Doctegrity is making quality care more accessible than ever without the need for insurance. Jesse is going to share his journey from the world of corporate talent management to healthcare innovation, how Doctegrity is helping families save money on medical and pet care, and what the future of healthcare looks like in a world where convenience, affordability, and technology intersect. Whether you're a parent trying to avoid a pricey urgent care visit, a pet owner wondering if your dog really needs that vet trip, or just curious about where healthcare is headed, this episode is packed with practical insights you won't want to miss. Let's jump in. All right, Jesse Ohayon, thanks so much for coming on the Healthcare Wayfinders podcast. I'm super excited to have you on here. We've been working together for a while now, and excited for our audience to hear about what you guys are doing at Doctegrity. So tell me a little bit about yourself, tell me about Doctegrity, and then we'll just jump into it.
Yeah, thank you, Zach. It's been a while since we started working. I was looking back, I think almost like 4 years. So yeah, in terms of myself, I grew up in a middle-class family. No, I'm just joking. We've heard enough of that already. So I took a very different path to get here than most of the other people that I run into in the healthcare space. Back and way up. So I'm actually originally from Toronto, Canada, since the whole hockey thing. And after college, I started working, and I was actually in a very different space. I came more from the people operations space, talent acquisition, talent management. Left Toronto. I was very excited to get out of Canada for a number of reasons, but left, moved to New York City, and I ran the IT talent acquisition team for Merrill Lynch. Moved to the West Coast. I ran contract labor talent acquisition for a little company called Walt Disney. Did that for a few years. Left to join Adecco, world's largest staffing company. And as one of the leaders, we ran the Western US for Adecco. Adecco is the world's largest staffing company that has about 750,000 contractors. That's when the wheels started to turn. So I noticed as a company, early mid-2000s, we didn't kick in anything towards health insurance. So if you were a contractor, you were on your own or you're paying the full price for the health insurance plans. And as people missed time, I just thought there was such a big opportunity. Like something's wrong here, right? This Canadian with socialized medicine, which wasn't great, to be honest. But in my mind, I went to, if there was just a better net plan, maybe something cheaper people could take advantage of. But when you had people that were hourly wage workers, if they're not at work, if they're not making money, if we placed them at a company that they were supposed to be working at, if they weren't there, they weren't too happy with us. And of course, as a staffing agency, you're not making money if that person isn't there, if there's not a butt in the chair, as they say. So I kept that in the back of my mind a little bit. I followed my mentor, my boss. She became president of a large government contractor in Philly. I was there for about 4 years, but really wanted to get into healthcare. 2 of my 3 older sisters are actually physicians, so a big influence on me. And so I went to go work for a company called Schumacher Clinical Partners, as they call themselves nowadays. And I walked in there as a 36-year-old senior vice president of operations and talent management, talent acquisition. And after some time there, the chief medical officer of that company left. That's how you and I got acquainted, actually, Zach, through Dr. Sylvan Waller, amazing guy. He left and became chief medical officer of MD Live, called me and said, "Hey, Jesse, these guys need help. Can you come to Florida, run a project?" I said, "Sure." So I at MD Live, I was like, this is the thing, right? Telehealth, like you can FaceTime with a doctor, right? And it was not so simple, but yes. So once I got the hang of it and did a lot of work there for quite a while, I said to Dr. Waller, I was like, this needs to be more of an employee benefit. Like I hear what they're doing, but just being part of insurance is fine, but that's their approach. But this needs to get in the hands of like people, right? It's got to get out to the masses. This is probably 2016, 2000. He said, "You're right, we're leaving and I'm going to help you start your own," which he did, and just really pointed me in the right direction and doing some consulting for a bit till we got up and running. So 2017, we formed the company. In 2018, we got our app built in the App Store. And back then, we were called Remedy.me, but there were too many remedies in healthcare. So in 2020, we rebranded to Doctegrity. And that was the whole thing. It's, hey, we're not insurance. We don't pretend to be. We're just an employee benefit or just a benefit for people. So we do a lot in, let's say, the corporate space, but people just come to our website and sign up. And so what do we do? So there's a number of things. So the main thing, of course, is 24/7, 365 nationwide telemedicine. You can video chat, speak to a doctor. Doctor writes a prescription, the pharmacy, your choice. Definitely a big need for the Spanish speaking population. So everything we have is available in English and Spanish. Bilingual doctors, technology, member services, all that as well. We also saw that a lot of the people that we serve either don't have insurance or don't have great insurance or don't really go to the doctor that often. So we have a capability where people can upload blood tests if they want. They can upload imaging to get from you guys, for example. They do that and then say, what does this mean? And or they can take a prescription bottle and say, I don't feel when I take this. What else can I take? So all of that's included. And then we added in the mental health piece. So we don't do psychiatry, we just do mental health therapy. So you have companies like BetterHelp out there, which Tom Brady pushing, which is big. BetterHelp, that's BetterHelp. They have Talkspace, that's Michael Phelps. And it's great, but even BetterHelp with the promo code is $80 a week. So it's still not affordable for a lot of people. So I say we're designed to be the Goldilocks. So we do short-term mental health therapy, about a month of therapy per issue. And then we have a whole bunch of discounts for hearing, vision, dental, gym, and wellness discounts, prescription discounts, and of course the labs, right? So there's more and more things that people can do with their lab tests. So having that, grassroots partnership that we have with you guys is amazing because people can say, oh, I have to go get this test. It's probably really expensive. I'm like, well, check it out on the website. It's pretty good to have a look there. So it's really amazing to say, hey, like a CBC blood panel is like $10 and to go to any quest to get it done. It's big, such a big value add for a lot of people that sometimes they have their own, or they just want to know. They just want to know what's going on. So that's what we do. The other cool thing, which I won't demo, but at our core, we are a healthcare technology company. So you can go back to like my Disney days and geeking out on a lot of this stuff. I always said I'm a tech nerd and at heart. So we have the capability in our app now where you can hold your phone to your face and in 30 seconds, our app can scan your face and with 90% accuracy, tell you your vital signs. So blood pressure, heart rate, variable heart rate, how hard your heart's working. We even calculate mental health stress index, and we have your risk profiles as well. So it's not FDA approved. We trying to FDA cleared. We're registered, but basically we're about as accurate. It's about 90% accurate. So we say we're like the blood pressure cuffs you would get like at a CVS or Walgreens, that type thing. But instead, people may have them at home. Who knows? Or the batteries, or you might use this right. I don't know, but everyone's got a smartphone. So that's the beauty of it. It's a really cool piece of technology. So that's what we're up to basically. This year we also launched our Doctegrity eVets. So now you can video chat or speak to a veterinarian for your pets. People spend more money on pets they do themselves, and pet insurance, like health insurance, expensive, not always great value, but strip all that away and just talk to a vet and say, hey, my dog ate a bar of soap at 2 a.m. What do I do? And so that's what we're up to essentially. Yeah, that's a lot of our day job. There's a few other things in there, I'm sure, but that's the bulk of it. So long answer, but basically a very different path than, let's say, some of our competitors like Teladoc, MD Live, that they just came from the hospital system and just virtualized some urgent care. That's not what we want to do. We want to get care, access, either if you have insurance or not, it doesn't matter. We don't take it, don't need it. It's pretty low cost, and just give people access to the doctors. So that's a nutshell of it.
Yeah, that's great. Would you guys say that you're like a primary care alternative, or somebody can use you guys as like their primary care? Or I don't know, how much could somebody access or utilize your service for your normal everyday stuff?
So I'd say it's a mix for like primary care. We always say, like, don't get rid of your doctor, right? That's the first thing. For the things that need care right away, so like ear infections, eye infections, flu, strep throat allergies, those type things, that's really easy for us to handle. We run about 10 minutes nationally and they're talking to the doctor. Now, if you need refills, blood pressure medication or cholesterol medication, or somebody forgets they're traveling, whatever, that's really where we come in. We can write those kind of refills if they need those for anything as well. So that's nice. It's just tough to diagnose those from scratch. If somebody has diabetes and they need their refill on their insulin, that's something that we could do, of course, in a pinch. But we wouldn't diagnose it from scratch type thing, if that makes sense. So we're definitely more flexible than the telemedicine companies out there. Again, that's our whole purpose. Stretch a little bit, provide more value, but definitely for most of the things, like 80% of what people go like an urgent care for or primary care doctor for, typically we treat.
And that's so important because, at least for me, most of the time, even if you have insurance, most of us are on like a high deductible healthcare plan. So we're just cash paying for any time we need to see the doctor anyways. And if I'm feeling sick, it's going through my head like, can I make it through this, or am I going to actually have to go and spend $250 to see the doctor for them to probably tell me it's a virus, you just need to sleep and drink more water. Having a service like
It's
y'all.
gonna suck for 5 days, and yeah, exactly.
Yeah.
Not much you can do about it, and ride it out. But yeah, and exactly, it's people are frustrated with those with a lot of the urgent cares and the waiting, and then through COVID we really, that's when we really got on the radar, right? Was through COVID, and because people are like, wow, this is a great alternative. I don't want to sit in a waiting room with other people coughing on me, and who knows, and how much I'm going to pay for this. And I think that's very interesting though, Zach, like, because even though you hand them your insurance card, you don't really know what if you're going to end up paying, or what bill's going to come in the mail. So that's pretty big for us to be able to say, hey, we're a subscription model. So I say, you think of us one way, think of us as like Netflix of healthcare, because it's a subscription model. See as many shows or movie you like, you don't pay anything. Same thing with us. There's no co-pays, there's no consultation fees for the doctors, therapists. And I think that really works. In whatever plan you're on, like, we don't need insurance, we don't take insurance, it's just cash pay. We're, for the retail market, we're like $20 per family per month. That's pretty reasonable, even if you're paying for whatever for your health insurance. But if you have it or not, then just go that way. You're not paying anything out of pocket. You don't have to worry about it. Like, we live in this DoorDash, Amazon Prime world, and healthcare tends to be a generation behind. And that's exactly what we set out to do, was to say, this can be done easier. Just strip away this Medicare, Medicaid. Don't take any of that. No insurance, nothing. Just go to help people get the care in their hands. And I feel like grassroots is the same thing. It's like the order and back, and where it goes, it's covered, it's paid for, done. Walk in, get your blood draw, done. When wait for the email to come through the results. It's the same thing with us too. So that's what I loved about you guys. We're both heading down the same path, right? Just different avenues, but that's exactly it. It's just, we live in this app-based world, and just healthcare lags.
I think it feels like there's somebody out there who is trying to get access to the healthcare they need. It's just so expensive. Maybe even like their insurance plan from their employer is super expensive, and they might be just trying to put something together almost DIY. Like, they get a catastrophic policy to try to lower their monthly premiums, and then they work with somebody like you to try to take care of 80 to 90% of things. And then worst case scenario, they're working with their primary care doctor like down the street. It feels like people could really utilize y'all to save a lot of money and customize it for them, as opposed to just taking a big plan that's given to you and just paying your huge monthly premium.
Yeah, yeah. So I know for a lot of the listeners, there's a whole like insurance game, if you will, or industry. It's the health insurance industry. Healthcare is bigger than any other industry in the US, bigger than oil and gas, right? And bigger than a lot of these big industries we hear all the time. But a lot of companies, big employers, self-insure, right? They're the self-funded insurance. You may have heard of that before. But you're right. People are starting to do that model, to self-fund or self-insure themselves, right? Hey, just take, whatever money I'm going to spend on the Primo Gold PPO plan, why don't I take a catastrophic plan, throw in a plan like Doctegrity, and I'll just put some money aside in the bank account, aside from the HSA. Like, I'll plug it in there for my rainy day account in case something happens. They're still net way ahead of the game. They need lab tests, whatever it is, doctors, prescriptions, whatever. Great, we got them covered. You got them covered. It's just a bit of an education thing, right? It is, people don't know that we exist, or you exist, right? That's the whole thing, and hopefully this helps. But at the end of the day, you have a lot of flexibility, and that catastrophic plan for those catastrophes is exactly that. But you're still going to be out of pocket quite a bit. So if people are putting money aside, it's really not a bad way to look at that. Yeah.
Yeah, I love it. Can you guys see like a whole family, like parents and kids, or how's that work?
Yep. Kids 2 years old and up. Under two, you got little kids, right? So under two, a fever could mean so many different things. So we typically don't. But yeah, all ages, all the way up for most common things. Yeah.
That's great. You've mentioned it a little bit, and just since you guys have been around pre-COVID, how's COVID and everything that's happened with that and what it did with telemedicine? How do you feel like that's changed, or has it changed how people
Yeah.
access healthcare? Are more people familiar with telemedicine solutions that they have it, or did we forget that like we've put COVID behind us?
Yeah, no, a great question. I think so. Pre-COVID, if you asked three people like what's telemedicine, you would have got three different answers. So that was the first thing is, man, I loved it and I'm invested. So I'm dumping. This is the future. I need to be here. And the first thing was like, how do we level set? Like, how do we educate everybody on what is this? And so it's more just those like explainer videos or whatever it was back in the day. Now everyone's pretty clear on it. I got into this during the tail end of COVID. Got into this online, I don't like to do this on social channels or whatever, an online argument with an industry expert, let's call this person, and she had many letters after her name and her title and PhDs, so on and so forth, about telemedicine's a flash in the pan, and that's it. This is dead. When I was a kid, little kid in the 80s, I remember my dad brought home a microwave. Like, we've never not had a microwave again, right? There's certain things you don't go back on. No one's having a Blu-ray player now and saying, man, I miss those VHS tapes. Maybe you miss what's on them, but nonetheless, like, we move forward, right? So we move the needle. So I'm glad in the end, even though I don't have PhDs or whatever, I was right, like that the industry continued. Now, what we're seeing towards the end of COVID and all that's ending. But the last piece is these telehealth flexibilities. And it's actually through the House right now that these are getting extended. At first, they wanted to extend them for a couple years into 2026. But now it's like, why? Just do away with this because there's so much benefit here. Now there's some stuff like what we can and can't prescribe. So for example, like we don't write controlled medications, anything controlled like we can't write. Unfortunately, that's probably the number one complaint we get. People see doctors, mental health, and they say, great, I need to refill my Xanax. And unfortunately, like we can't. But there are some flexibilities with controlled substancing. But even like the Medicare and Medicaid world, insurance world, what they can and can't bill for telehealth, all that's getting extended. It doesn't really affect us, but it's just really interesting to see. And even the high deductible plans, it's through the committee that there was some concern about would you still have to use your HSA card or not? And all that's going away. It's going away. And it's nice because it's here to stay. So gone are the days of trying to explain what this is. And the other thing, Zach, and hopefully it's good for everybody, the biggest chunk of the US population are millennials and Gen Z. They make up 45% of the population. They're actually the biggest portion of the US workforce. They, like I said, they live in this DoorDash, Amazon Prime world, and healthcare has to be at that level for them to access it, make sure it's easy, simple, app-based, personalized. And that's really big, right? So it's not going away, right? And that's the good thing. It's just more about the approach and what people want to get out of it or how they see using it, or maybe it is ongoing maybe it is worth that therapist once a week, whatever, ongoing for whatever price, because that's the way the world is now. Yeah. So I think it's definitely here to stay. Of course, there's a big dip in utilization after COVID for obvious reasons, but people are like, this is pretty good. We're not going to live in a house with no microwave again. Like that's same thing. It's here to stay, which is great.
Yeah, I like it. I'm trying to think of, I'm getting like a picture of the Jetsons or something like that. Do you guys have are there like new devices that are going to be coming out that are going to increase what you guys can do as far as treatment and access and stuff like that? We talked about smartphone, which already we can do so much with. But what's out there, what's coming that you guys are excited about when it comes to being able to increase your accessibility of your service?
God, we didn't even have this scripted, so that's amazing that you asked that question. Great story about this. What we do, so we use people like use your phone, like Apple, Android, whatever it is. So it doesn't matter what device, tablet, computer. So we're not hardware guys, right? We're not hardware people, like it's software, it's technology, great. So about a year ago, this time, I was driving, long drive from Dallas to South Florida to visit my 97-year-old father. My mother's in her 80s. And talk about health. I mean, he's doing great. But my daughter came with my oldest daughter, Michaela. She's 13, 12 at the time. And I don't get much windshield time. And I was like, let me listen to a podcast. So I turn on, it was Joe Rogan and Mark Zuckerberg. And I was like, oh, it's going to be fireworks. So let's hear these two. I don't know. Let's just see what they have to say. And it was very interesting. It was very cordial, of course. But for 2 of the 3 hours, Zuckerberg talked about the Oculus, the Meta Quest, and how it was outselling, it was around Christmas time. So it was poised to outsell the Xbox. Great. But he goes, but this is coming to the working world. So I'm in Dallas, you're in Atlanta, maybe there's some other people around the country, whatever it is. We could have 5 people sitting around, and if we're each wearing the Meta Quest, we could have a poker game and it would look like we're all there. And that's the kind of crazy thing. But really, Mark Zuckerberg talked a lot about how it's coming to the working world, and this is going to be part of our lives going forward. And really, it just struck a chord with me, struck a nerve, whatever. It was just really interesting that I said, there's got to be a play here. There's something more than 12-year-old daughter Michaela said, Dad, you need to get Doctegrity on the Meta Quest. Like, it's only a matter of time. And I said, how would you see this working? She goes, think about how much better it would be instead of just like a 2D video or 3D video. You're talking like 4D and all these different things. You'll be able to see better. Would the doctors be able to see better? I was like, yeah, kind of. So we filed that patent this year. Actually, my daughter Michaela is on the patent for it, but it is
Congratulations.
Yeah, thank you. So we've actually filed 5 patents over the past 18 months. So it's for all different kind of things like our vital scanner, but the MetaQuest is the newest one. It's not just that, it's AR, VR, whatever. But basically, that's where we're going is we gotta, and I think it just speaks to what we're doing is we know this is going to be evolving. I don't even think it's a 2025 thing. We're building the app for it, but it'll probably be like early 2026. And think about when people would want to get together and talk about an idea or about work or friends or whatever, you'd hop on a conference call back in the day. Then right before COVID, and because of COVID, like Zoom. Now we're all on Zooms. It's a better way of communicating now. We have video, we can see interactions, and you're on mute, whatever it is. But that's what at least I see as the Meta Quest is that next iteration. It's never going to replace in person, but it would be better. Think about all the people that you know that, and I know a ton too, that have social anxiety, right? Since COVID, they don't want to go out, whatever it is. Still, they're very much home-based and a lot of hybrid work as well. So hybrid remote workers and just that whole rise of that community as well. But to have a mental health visit with your Meta Quest, and what about if you don't want to show your face? You could be an avatar if you wanted to, right? Or celebrities, they could talk to a therapist, right? Much better that way as well. We do a lot for police and former military as well. We serve a lot of those communities, and maybe they don't feel comfortable talking about really showing who they could almost use an avatar as well if they wanted to with that device. But it's a better interaction, right? You can look like you're at the therapist's office really while you're still at home. So again, geeking out totally, but with our vital scanner, we're going to continue to improve that so people could take more of their vitals just from their phone. But yeah, that's even where a little look under the hood about where we're going is I'm passionate about these new technologies, but it is using things that people already have. We're not going to be, selling MetaQuest or whatever, like people have them at home. Great. You'll be able to use that too. And that's what we want. So we want people to use whatever they have, phone, Android, computer, whatever, that's fine. But we're looking ahead is the MetaQuest. So yeah, excited about that.
Very cool. I wanted to circle back to you talked about you guys are offering like vet visits now over telemedicine. Talk to me about that.
Yeah, so it's basically the same thing with our telemedicine. Now we have vets as well. So you can video chat, live chat, or speak to a vet. Again, we get a lot of questions about it is a lot of the household pets, but we have large animals. In Texas, you can see horses, cows, whatever it is, exotic animals, and
Cool.
island as well. And yeah, same thing. I think the first thing is, do I need to rush my pet to emergency pet hospital or not? Because that's expensive. And if you could avoid that, and the vet says, it seems okay, this is normal, whatever it is. And if it's worse, let's call back or check it in the morning, that type of thing. We could do that as well. But odd behaviors, it's different, right? When you're talking to pets, they don't talk, right? So you need to talk to the vet who can really share what's going on and what they see and odd behaviors and changes and all that as well. I have a 1.5-year-old puppy or before. So this is new. So it's actually very helpful because I just don't know. Eating chocolate, it could be fatal, right? To know that. We got a lot of people that put in requests that what happens if their pet eats some of their edibles. That's probably the number one question we get, believe it or not. But is it bad? Is it fatal? And the dog might be hungry later, but basically it just depends on the breed. Don't take my advice. Talk to one of our vets. But that's a big thing that people that call in for, whatever it is. So yeah, so it's really helpful. I think again, those vet bills can get really high. We also have a pet prescription discount card. So here's a little tidbit. Like typically, if you have a pet, you get the prescription from the vet's office. You can. It's a big moneymaker for them. But really, CVS, Walmart, Walgreens, they all carry the same pet medications. So you can just tell them to have it sent
Wow.
there and use the prescription card there. They all
I
have the
didn't know
same
that.
medications. Yeah. That's actually one of the concerns from the Veterinarian Association that at first they didn't want to let anybody write prescriptions because think about it. If someone called in and said, yeah, my pet's really scared of thunder and can I get Xanax for the dog? And unfortunately, a pet owner is going to try to take those meds. And that was their main concern that they said, this is why we don't want it to happen. Or you would have had to seen the pet before. Now right now, as of today, there are 18 states. By the end of 2024, beginning of 2025, there should be about 40 states that we could write prescriptions in and hopefully more as we expand out. With pets, a lot of them don't need prescriptions per se. It's a lot of over-the-counter stuff, and maybe it's an Epsom salt bath or whatever takes away the itching, scratching, whatever it is, and that will do the trick. But you just need to know. And again, for whatever, we're pretty low cost, and that's closer to $10 per household per month for all your pets. That makes it really nice for people to have that benefit too. And yeah.
Wow, you're just saving people money left and right, Jesse.
It's not, in other words, I say it's like there are easier ways to do things. That's the whole point of what we're doing. It's you don't have to go get pet insurance as soon as you get a pet. So that was my first time getting pet insurance. Does it go with the dog? What happens if this? What happens if that? And just running to the vet every time because you just don't know. And now there's an easier way to know. So yeah, so whether it's people or whatever it is, like sometimes like when you're sick, you're like, I know what's wrong. I just need a Z-Pack or whatever it is. And by the way, don't tell the doctors what you need, they'll tell you. But I would say, but at the end of the day, but if you know that when you feel sick, sometimes, yeah, I just need this antibiotic, I need an antibiotic, and something's off, and you get ahead of it, right? It's much better than waiting. Or somebody in your house may have the flu. You can get on Tamiflu prophylactically. It's the same thing, but if you could wait, you might get sick, you got problems. So this way, it's just there's easier ways to do things, and why not do it?
Yeah, I'm right there with you. We have something similar to that, and it's, hey, we're always going to be patient first. Healthcare and veterinary is designed by a lot of different stakeholders, but if we can create something that's better and more cost effective for the consumer, I think we're going to be doing some real good in the world, and I think that's what y'all are doing. That's what we're doing. But we're almost out of time. Tell me a little bit about if somebody wants to sign up with you. Do you have just one big plan where you get telemedicine, the therapy, and your pets all at one time, or do you add and drop what you need? How's that work?
Yeah. So our main thing is, so we go to doctegrity.com and we have individual family or individual couple family. So we'll do this for all the listeners. So just pick the family plan, even if you're individual. And at the end, there'll be a promo code. Type in get well. Altogether, no spaces, and I'll give you $20 a month. That's probably the best way to do it because otherwise it looks like it's $45. That's our retail rate. And so you get $20 per person per month. That includes the telemedicine, mental therapy, pharmacy, lab discounts, hearing, vision, dental discounts, and then our vital scanner. We are putting up our televet Doctegrity e-vets on our website. Right now, we have our corporate clients. So if you work at a company, they could have your HR person contact us and we'll get you connected. And to give you an idea, it's about $10 per household per month for the televet. But maybe by the time this podcast is out, we'll have our televet on our website that you can sign up for as well. But yeah, it would either be, we can add it on, a la carte, whatever works. We're pretty modular, but yeah, that's what we're up to. So hopefully we'll have it on our website shortly. But in the meantime, if you do want it and you work at a company, or just drop us a note, hello@doctegrity.com, or talk to your HR person. They'll probably get connected with us. But yeah, just go to our website, click sign up, and type in promo code GETWELL, and you should be all set and get your logins right away.
So great. Jesse, thank you so much for coming on the show. It's been great talking to you. To everybody who's listening, we'll make sure to get links to Doctegrity and everything Jesse talked about in the show notes so you guys can find them and check them out. So thanks, Jesse. Have a
Thank you,
great
Zach.
holiday,
Too.
and we'll talk soon.
Sounds good. Thanks.